Good afternoon, ladies and gentlemen. Good morning, I should say. Thank you for joining us today. We're here in the council chambers at the City of Weatherford. Mayor Paul Paschall being joined today. Thank you for your time, sir. State Representative Phil King is with us this afternoon, this morning, and we're going to have a Q&A, a conversational discussion about COVID-19, your involvement in that, how we're preparing, how we're handling that, and again, thank you for being here today.
Thank you.
I'd like to start out with the first question, if that's okay with you.
Sure.
Tell us about your role on the state level with COVID-19 and tell us a little bit about what you've done and kind of what are we doing to help the constituents and kind of what's being done to help citizens across Parker and Wise counties.
Sure, thanks. And thanks to the city for setting this up. And being in this empty room, I feel like my pastor does, speaking on Sunday and there's no audience there. But
an odd feeling for sure.
Yeah, it is different. First let me say this. I know this has been extremely difficult on all of us. It's hard on our families, although in some ways we're getting more family time in some circles than we've had for a long time. But it's difficult. We're separated from family. It's a struggle for our businesses. If you're an employer and you've had to lay off friends and people who are almost like family because you've worked with them for so long. Some of us have people that have friends who've been through this illness or are going through it. Others are having to drop someone off at the hospital for maybe heart issues or something else that's very serious, and they're not able to go in with them. And so it's just creating so much separation. And it's just been hard on everyone. It's been hard on me and my family as well. Whether you've been affected directly by the illness, we've all been directly affected by the pandemic. And I think it's been really fascinating, Mayor, to see how wonderfully people from Parker County and all of Texas and really all across the country have responded. We haven't had looting and we haven't had riots and this type of thing. What we've had is just people showing a lot of love and compassion and philanthropy, and it's just, in that sense, it's been really encouraging.
Sir.
So for me and how it's affected what my role has been in the legislature, it's really been, first off, it's a lot of brand new, but it's been across the board. I'll give you an example. Yesterday, I got a call from a sheriff's deputy whose wife had been an employee for a long time at a local restaurant and was laid off, and she had contacted the Texas Workforce Commission to see about getting the unemployment, which she is due. And she went online and registered, and then she got something from them that said, you need to call us within the next 3 days, otherwise you'll be dropped. So she spent the next 3 days trying to call that agency that's been now getting 60,000 phone calls a day. And she couldn't get through, although she tried all day. And then she gets an email saying she's now been dropped from consideration because she didn't return her call. So it's ridiculous things like that, and we got a touch, and so we're getting her kind of backdoored into the commission. So it's been everything from things that are very personal and very local to trying to fix some of the problems that have been at the congressional level with regard to the stimulus programs, the PPP, the Payroll Protection Plan, and also EIDL, the loans that's available, and the confusion that there's been in how banks are to apply that to a lot of our businesses here in Weatherford and Parker County, particularly sole proprietors, people who are paid on K-1s or 1099s, things like that. And so I've been working very closely with Congresswoman Kay Granger, who has been magnificent through all this, as well as Kevin Brady, who formerly chaired Ways and Means and in the House and wrote the last tax bill, and trying to get some language. In fact, I drafted up some language, which I was told yesterday by Kay, has been submitted to the Secretary of the Treasury and is hopefully going to be incorporated. It's also with the Ways and Means Committee, to be incorporated into the next stimulus bill to fix that language for our small local businesses. So it's been everything from dealing with very, very local personal issues to trying to do things on a larger scope that are affecting business more at large.
Sure. So let's transition a little bit. Where do you feel like we are today from a state perspective and your implication locally in our COVID-19 preparation? And let's talk about the timeline of this and maybe a little bit about the governor's rollout. Any expectations for that? Or
Well, where we are today is, first off, this is a brand new thing for all of us. And even on February the 29th, Dr. Fauci had said that there was no need to take any emergency action at this time. And so this is really, we forget, March was the never-ending month. It just never ended. And now April kind of feels that way too. But we've got to remember, this is still a very new situation for us that really just began 6 weeks ago.
Yes, sir.
And, but the initial plan, which was implemented in Texas and really nationwide, was to try to slow the progress of the illness, slow down how quickly people were getting it. We know that before it's over, a lot of people are going to get it because it's so contagious. But the idea was slow the curve down to give our healthcare providers and our first responders time to ramp up and be ready for it, so that we won't end up like in Italy or like New York, where we had just such a rush that we couldn't meet the demand initially for people's care. Texas has done a magnificent job. We've had some hurdles, trouble getting personal protection equipment and other things, but I can tell you that today Texas is ready. Medical City Weatherford, they were told to take their 15 ICU beds and get ready, ramp those up to 60. They were told to have the ventilators and other things prepared that they need. They are ready today. They are ready today. And that's true across the state. And so we've now ramped up. The next phase, in fact, the governor's strike force that he had created for procurement has been focused entirely on PPE and other things for healthcare. Just this weekend, they were redirected to start working on mass testing. And that'll be the next step for the state, because if we're going to open things back up, which we have got to do, you've also got to have mass testing be a big part of that, so people can know if they're sick, or hopefully find out that they've already had it and that they didn't get very sick. Right. So we're moving into that testing phase. That's going to be slow because 3 months ago, nobody needed a test. Right. Now, all of a sudden, we've got to have things that can test 29 million people in Texas, and that's a big undertaking.
Absolutely. And so, speaking of Texas and business, because I know you're very pro-business and small business, any idea or thoughts on what that might look like as far as, could that be something that'd be phased, or different options being evaluated at this time?
So let's kind of back up where we started. So early in March, the governor issued an emergency order, which had some directives in it, but it also just had a lot of common sense, please don't try to aggregate too much steps. Then we had local cities and counties across the state, many of them begin to issue their own emergency orders, some going very, very far. And so all of a sudden you had very much a hodgepodge, city to city, county to county, on what was restricted and what was not. So let's take Tarrant County, for example. If Fort Worth had different regulations than the other 33 cities there, just driving from DFW Airport to Weatherford, you'll cross, I counted it up once, I think 16 or 17 different cities. Okay. So it became very much a hodgepodge and hard to operate under. And some of the communities probably went too far too. Don't want to blame anybody for that, because everybody's trying to make decisions on data. And to be honest, we're just now getting reliable data to make decisions on. So people were doing the best they could. So then the governor came out with more of a broad statewide sweep, which had some very strong guidelines in it. Sure. And directives. So that's where we are today. The question is, and the governor's indicated that he's going, and the president's trying to move in this direction too, to now that we are prepared for any onslaught of illness in our healthcare providers, how do we phase out of this? And I think that's the level of discussion that's going on right now. The governor's about to issue some plans for that. And I personally can't speak for him. I will be surprised if you see anything change before the 1st of May. And then I expect at the 1st of May, we'll begin to see a staging down of restrictions to allow people to get back to work, maybe some schools to get back to operation, because we have got to get the economy back going.
Yeah, as Texans, we're wired to work, right? And that's the whole foundation. So let's talk about the economy for just a minute. It's difficult to gauge or to assume anything at this point, but can you talk a little bit about the economic impact of the state and maybe the next biennium for your group?
Sure, and let's think about how it's affected us at the local level. These restrictions are really a two-edged sword.
Sure.
So on the one hand, you put in restrictions, stay-at-home restrictions, don't go to work restrictions, so to slow the spread of the illness. And you do that to hopefully protect people's health. The two-edged sword is when people can't go to work, they lose their health insurance, they lose their income, they lose the ability to get health care for other things. So someone has lost their job. How do they get, they lose their health insurance. How do they get that cancer treatment? How do they get their child's asthma medicine? How do they get their heart medication that they take? How do they pay for that? So it's a two-edged sword. You by trying to protect them on one hand, protect their health, keeping them from getting COVID. On the other hand, maybe they can't get the other health care they need or just the other surgeries that they need. You've probably heard, I have too, of some situations, people very much need surgery. They're hurting and they need it, but it's not urgent.
Sure. And
so they're not getting it. I had 2 anesthesiologists talk to me about how, and they run pain clinics, and they've been trying to keep people off of opioids. Well, they can't get people in to give them a shot in their back or to something in their neck, and they're in tremendous pain. So what are they doing? All they can do is write them scripts for opioids, which is exactly the opposite of what they want to do.
Absolutely.
And so you're creating some healthcare issues here. So, and I'm sorry, I kind of digressed from your question there, but the economics are not just a matter of, for us individually, of us not having money to pay our bills, which is incredibly important, but it's also not having money to meet healthcare needs that we already had ongoing.
Yes, sir.
So there's health issues on both sides of this. But as for the state, about 60% of the state's income, and you got to remember, Texas is really its own nation. I mean, if we're our own country, we're the 12th largest economy.
Everybody knows how good Texas is.
That's right.
Yeah.
And so our budget is like $250 billion. It's huge. And about 60% of that, if I remember correctly, comes from sales tax. Well, what's happening with sales tax right now is the same thing's happening in the city of Weatherford. It's down about 50% because people aren't out there to spend money. If it wasn't for online commerce, it would be really, really, really low. So that's going to impact, and about 50% of the state's budget is education and health care, right? So we're going to walk in next January when the legislature meets, and we're going to walk into a large deficit, larger than our rainy day fund. And we're going to have to do some very serious prioritizing of state expenditures. And I've been through a couple really tight budget sessions before. This will be the worst. You know, we want to stick with that huge commitment we made last year to fully fund public education. We've got all the other state issues to take care of, state agencies, whether it's transportation, building roads, building highways, prisons, all the different things that the state's involved in. And so, but again, about 50% of our budget is just education and just health care. So we're gonna feel it, and you're gonna feel it here heavily at the local level.
Those are decisions that cities are going to have to make, counties, you know, just like the state is, and it's going to be difficult and different potentially from county to county, city to city. So the one thing that we do know is we know how to work in Texas, and we know how to stick together and team up, and so we'll be able to overcome that better than any other state in the nation. So let's stay on healthcare for a minute. Is there anything you'd like to say? It's funny how the heroes that we've seen in our communities or in the country have been, for some people, athletes, actresses, actors, et cetera, but now it seems to be the healthcare workforce. So any advice or just thoughts or appreciations towards that work sector and the exposure that they're up against right now?
Yeah, I think both our first responders and especially anyone that's in on-the-line healthcare.
Sure.
That, I was thinking about this morning. So I was a police officer for about 15 years. And when Terry and I married, I was a police officer. So all she ever knew, and I always loved being in the field. That's just where I wanted to be. And so all she ever knew was that Phil would leave for work every day and he'd have to carry a gun, and there were risks involved in that. I never forget when I left, she told me, she goes, I never even realized how much stress and pressure was on me with you just going to work every day. And Terry's not a worrier. She's strong as anyone can be. But she said, I never realized how much hidden pressure there was, me just knowing that you're a police officer going out in the field at night and doing all this. Until you left, and all of a sudden that was off my shoulders. And I said, wow, I never knew it was there. I know our healthcare professionals and our first responders are feeling some added pressure, a lot of added pressure, because they don't want to catch this sickness and they don't want to take it on to their families. And then they're having to deal with people, particularly in some of the hot spots, not so bad around here, but Houston and Dallas, some of the other hot spots. But there's also a lot of latent pressure that's on their families.
Sure.
Because their families are worried about them. Their families also know they're at a greater risk that they may be bringing something home to them. And so, all of our hats need to be off, and our gratitude need to be there for the people that are willing to walk in every day into an ER, into an ICU, or respond on a fire call as an emergency, providing emergency medical service, or they're for law enforcement, not knowing what they're walking into. We need to realize that they're under added pressure right now. Mm-hmm. And we also need to remember their families are too. Mm-hmm. It's even if their families don't realize it, that pressure is there.
Sure. Well said. Just excellent. And so let's talk about testing for just a moment, if you don't mind, and maybe a little bit of data associated with testing. So how often are you updated on testing, and how does that received by you, and any thoughts on the current trends or what we can expect in the future?
Sure. And again, we have to start remembering that 2 months ago, there wasn't a need for a test.
Sure.
And so there's been a lot of push on, well, why don't they already have testing developed and distributed statewide, nationally? There's also, why don't we already have therapeutic remedies available? I mean, the hydroxychloroquine is obviously out there, as well as Z-Paks with that and some things that they're looking at, but nothing that someone can really say, this is the therapeutic approach. There's not a vaccine. Why aren't those things? Well, the reason it takes time to develop those vaccines. If you're not careful, you can create a vaccine that actually creates more disease or other illnesses. The earliest you would probably see something out there being developed is the end of the year. And then you've got to ramp up and for distribution of that, and that's a process in and of itself, a long process. Same thing on therapeutic remedies. They're finding some existing things that help, and maybe some of those will turn out to be the deal, such as the hydroxychloroquine. But the testing has been a real struggle. Abbott Laboratories seems to have I believe they have the only currently FDA-approved quick response test available. And again, everything, that's another thing. I got a call from someone out of Israel last week, and they have a relationship with a laboratory in Australia that has a quick test. But the first question is it FDA approved? And there is a fast-track FDA approval. I think it's EUA, I forget what that stands for, but it's a fast-track way to get approved right now in these emergencies. But we had so much fraud in the PPE. We had people ordering $1 million worth of masks, and they would get here and it would be something that didn't meet the standards that you needed. So all across the board there was fraud. There's great concern, for good reason, that there could be intentional fraud or just unintentional poor quality in tests. So we want all the tests to be FDA approved. Well, like I said, Abbott's got one there out there right now. I think there may be another one that's going to be approved in the next week or so, possibly. But then once things are approved, then they have to be mass produced. And then we'll be in that same struggle that we were in for PPE, as we're competing with all these other 49 states to get that stuff, competing with the whole world to get those things. What I will tell you is this, that the task force that the governor created to go after procurement for healthcare providers for equipment, as I mentioned earlier, their focus now is going to be on mass testing for Texas. And so I think to be able to open the economy up and send everybody back, if you go into that restaurant, you're going to want to know that people have been tested, and either they don't have it or they've already had it and are over it. And so mass testing has got to go side by side with fully opening up the economy again.
Yes, sir. Okay. So this is still early in the process. I think Ashley's got something for you.
Oh, yeah. Oh, and what this is
Speaking of data, it looks
speaking
like.
of data.
Yeah.
And again, that's been one of the big problems is getting data, because you have to have good data, and all the models have been all over the places. You got to have good data, and then you got to figure out what that data means. And we're just now beginning to get reliable reporting. Total tests for Texas have been 467,000 tests to date statewide. Only about 10% of the people taking those tests were confirmed to have or have had the illness. We've had, as of today, 318 fatalities in Texas. We have one of the lowest fatality rates in the country. Every death is a great tragedy, but we need to be very proud that we've only got 318 losses so far. And by the way, only 5% of our ICU beds in Texas are occupied today. So we have plenty of room. We're ready to go. We've got, that we know of, 2,580 people that have recovered of those that had tested positive, and I'm sure others have as well.
And that's brand new data, correct?
That's just, yeah, that's as of 5 minutes ago.
Okay. And that's how fast this changes from moment to moment. And not only does Representative King just shared new data, he also, then we'll get back to what we're talking about, he also is extremely frequent in communicating with our city management team, with our county leadership, mayors across the county, and I think probably also in Wise County just as well as J.D. Clark and all his mayors. But the cohesiveness and the lines of communication that are open are just the start of many good things in the way that data has been positively affected by that communication, that teamwork. So we thank you for that. I know that we're still, I don't want to say early, but we're maybe midway through this process of this COVID-19 pandemic. In your evaluation process mentally, is there anything you'd go back and change of how we've handled this as a state early on? Just briefly, anything off the top there you can think of?
Well, the good news is Texas has the best emergency response system network in the country. Really, for bad reasons, is that we have more natural disasters than any state, between fire, hail, floods, hurricanes, tornadoes. So the good news is we were able to activate that network. I think one thing we've learned is that network hasn't had the training or the preparation for pandemics. Right. We had the communication, we had the interaction, the networking ready to go, but we've never dealt with a pandemic. I think what you'll see with us going forward is, in addition to training first responders and healthcare providers to respond to hurricanes and wildfires, they're going to learn how to deal with pandemics. And because if it's happened now, it could happen in the future. What do you do if you have a pandemic in Central and South and Central America and Mexico, and all of a sudden 1 million people flood across the border to get health care? So there's a lot of things. So I think we'll be training better for that. I will guarantee you we are now going to keep a stockpile of personal protection equipment so that it's ready to go, and we're going to have a system to disperse that. We're going to make sure that we have enough ventilators. I think we've got plenty of those right now. But I think when this is over, we're going to step back, take a hard look, and say, what did we need to have in place in training, in equipment, in people that we didn't have in place to deal with the pandemic? And we're going to have to move forward with that.
Sure. And to kind of piggyback on that a little bit, this is going to change the way that businesses operate and other things. So how would you say this is going to change us as a state, short and long term? Is that even anything that we can speculate on? This is such a moving situation. It's fluid, definitely.
There's a side of me that says I think we'll be shocked how quickly things get back to normal. As a general rule, and on the business side, if government will let us go back to work, which I know they want to do, government wants to do, people are going to find a way to make money, particularly in Texas. They're going to find a way to make a living.
Absolutely. We're
entrepreneurs. We're strong individuals. We've got rugged individualism. We're going to find a way to get back to work. I hope that also people have had some time for reflection, and I hope that they have realized that how important family time is. Sometimes we get caught up in the tyranny of the urgent. We've got these 4 Little League practices for select this week, which all that's important. We've got, I've got to make sure I'm at work. I'm working late tonight. I've got to work this Saturday. There's things that just pull us away. I think what I'm sensing is people are kind of getting a little bit of an adjustment and going, I think I'm going to pay a little more attention to my family. I've really enjoyed this time with them and being home more. And I'm hoping that people are, maybe it'll be an opportunity that we'll all come back and prioritize our lives a little bit better.
That leads into my next question. I'm sorry, go ahead and finish. How should people prepare to move forward? I mean, just physically, dollar-wise, mentally, spiritually. What are your thoughts on that? What would your advice be to people? You're a successful family man, businessman, and state representative, but just as a human, what's Phil King's opinion on how do people need to prepare?
Well, let's take it in the order you said. Physically, I think we've all been reminded that if you're going to get really sick, it's a whole lot better if you're healthy at the time you get sick.
Sure.
So I think there's a strong encouragement that all of us are getting to make sure that they stay reasonably fit, that they take care of health issues they've got, they don't neglect them, that they keep their immune systems up, try to eat healthy, all those things, so that when something bad happens, they're prepared to deal with it.
Sure.
On the physical side. On the economic side, it's been a reminder to me that I need to make sure that I've got adequate financial provision if I'm going to be sick for a month or away from work, whether that's from COVID or having a car wreck, that we've got a savings that we can get by on for a few weeks, that if worst comes to worst, there's life insurance to support my family if something happens to me, and that I've got, one of the first things I did, and I'm a lawyer and I should have already taken care of this, but I went back and reorganized my estate plan and all that to make sure I had a will under what it said and everything was updated and all that. So I think from an economic standpoint, it's making sure you can get through a few weeks without a paycheck. On the spiritual side, I think it's reminded us that everybody needs to live every day as if it can be their last day. I mean, I don't know whether I'm going to leave here today worried about, am I going to get COVID and have a car wreck and am killed in that car wreck? So I think everybody needs to make sure, just my personal testimony would be that everybody needs to make sure that they know what's going to happen to them if they die.
Absolutely.
That they have a personal relationship with Jesus Christ as their Lord and Savior, so that if they are killed in that car wreck tomorrow, or killed from COVID or whatever it may be, that they know where they're going.
Absolutely.
And that their family knows where they're going. So that I just think I hope that it's just been a good reminder that we need to be, as you put it so eloquently, that you need to be physically prepared, you need to be financially prepared for whatever the emergency may be, and we also need to be spiritually prepared because nobody knows what tomorrow brings.
We also have an opportunity in this process to have those conversations with people about the level of importance that spiritual base is.
Yeah.
So, well, those are all the formal questions that I had today, and I certainly thank you for your time. I'd like to thank the City of Weatherford staff for the help in preparing for this. The Weatherford Chamber of Commerce partnered with the City of Weatherford on this. Thanks to Tammy Gazzola and her team for their assistance on this. Representative King, I want to thank you personally. This has been a gentleman that has, he's actually the first person that brought to light to me that this was going to be something that we were going to have to deal with locally from the information and the data he was getting on the state level. He has stayed in constant communication with our team, with me as mayor, and also I've gotten just a few texts along the way to say, how are you doing? How are you holding up? Is there anything I can do for you? More on a personal level, and I just appreciate your heart. I appreciate your care for your constituents, and on behalf of the citizens of Weatherford and the council, we'd just like to thank you for your time today very much. So this is all that we have today from the council chambers at City Hall of the City of Weatherford. We'd like to thank everybody for attending today, and hopefully we can touch base back with you on future occasions with more information as things develop. But stay safe, stay smart, and stay faithful and confident, and know that the City of Weatherford is a strong community, and we will be stronger, and we will move forward in a way that nobody's ever seen before. And so thank you for being here today, and everybody have a safe afternoon.